Infectious mononucleosis can be caused by what? A. Cytomegalovirus. B. Adenovirus. C. Rickettsia. D. Epstein-Barr virus. E. Herpes virus. The Epstein-Barr virus causes infectious mononucleosis associated with the Burkitt's lymphoma in East African children. The virus is found in human oropharynx and B lymphocytes. It is transmitted primarily by saliva. The infection begins in the pharyngeal epithelium, spreads to the cervical lymph nodes, then travels through the blood to the liver and spleen. Epstein-Barr virus belongs to the family Herpesviridae and is the causative agent of infectious mononucleosis, Burkitt's lymphoma, and undifferentiated nasopharyngeal carcinoma. Infectious mononucleosis characteristically produces a marked lymphocytosis involving almost all of the lymphoarticular tissues. This leads to hepatomegaly, splenomegaly, lymphadenopathy, and lymphoid hyperplasia of the oronasopharynx. The peripheral blood smear contains atypical lymphocytes of the Downey 2 type. It is generally a self-limiting disease, however, it can cause a severe protracted illness that can at times prove to be fatal. Patients with an unusual immunodefect known as the X-linked lymphoproliferative syndrome frequently have overwhelming EBV primary infections, which can be fatal in the majority of the cases. Which of the following viruses consists of circular DNA that is partially double-stranded and partially single-stranded? A. Respiratory syncytial virus. B. Epstein-Barr virus. C. Hepatitis B virus. D. Varicella-Zoster virus. E. Lassa fever virus. The answer is C. Hepatitis B virus. Hepatitis B virus is the DNA virus that is part of the Hepadnaviridae family. The characteristic feature of the virus from this family is that the genome consists of a circular DNA that is part double-stranded and part single-stranded. The virions are spherical particles with an envelope. Hepatitis B virus consists of icosahedral core within a closely adherent capsid that contains cellular lipid, glycoproteins, and a virus-specific surface antigen called hepatitis B surface antigen, HBsAg. Respiratory syncytial virus is RNA virus that has linear single-stranded non-segmented RNA. Lassa fever virus has a circular single-stranded RNA in 2 segments. Varicella-Zoster virus and Epstein-Barr virus consist of a linear double-stranded DNA. Which one of the following is an example of a chronic carrier infection? A. Toga virus. B. Hepatitis B. C. Neonatal rubella virus. D. Retrovirus. E. Cytomegalovirus. The answer is B. Hepatitis B. Hepatitis B is an example of a chronic carrier infection where a carrier state can follow an asymptomatic infection, as well as actual disease. Neonatal rubella virus, cytomegalovirus, retrovirus, and Toga virus do not cause chronic carrier infection. HBsAg may remain detectable for life in many patients. Individuals who have positive findings for HBsAg are termed carriers of HBV. They may be inactive carriers or they may have chronic hepatitis. Anti-HBC is present in all patients with chronic HBV infections. BAG and HBV DNA may or may not be present. They reflect a state of active viral replication. HBV DNA levels are typically low or absent in inactive carriers. HBV DNA levels are higher in patients with chronic hepatitis B. High HBV DNA levels are associated with increased infectivity. Which of the following is a major cause of serious diarrhea in young children? A. Arenavirus. B. Parainfluenza. C. Human rotavirus. D. Herpes simplex virus. E. Coxsackie virus. A. The answer is C. Human rotavirus. Rotaviruses can survive the acidic environment in stomach. The virus infects the small intestine and damages the epithelial cell lining the villi. The virus causes permeability changes and cell lysis, leading to malabsorption with water and electrolyte imbalance. Rotaviruses are a major cause of diarrhea in young children and are associated with outbreaks in preschool and daycare centers. Rotaviruses cause extensive tissue damage, leading to serious fluid and electrolyte loss. A 20-year-old pregnant woman presents at 21 weeks gestation with symptoms and signs of preeclampsia. Her symptoms have been present for the past 2 days. Prior to that, she had flu-like symptoms and a lace-like rash on her trunk and extremities and a flushed face. Intrauterine fetal demise was detected by ultrasonogram. Labor was induced, and a stillborn male fetus was delivered. Serum was collected for viral titers of the suspected agent that had caused the patient's flu-like symptoms and fetal demise. The viral IgM titers were positive, as suspected. What is the most likely offending agent? A. Parvovirus B19. B. Herpes simplex type 2. C. Herpes simplex type 1. D. Cytomegalovirus. E. Epstein-Barr virus. The answer is A. Parvovirus B19. Parvovirus B19 is a member of the family Parvoviridae and is the causative agent of erythema infectiosum, fifth disease. The hallmark symptom of erythema infectiosum is a mild rubella-like erythematous rash that produces arthropathy, especially in women. The disease has 2 separate components. The first component is the lytic phase, where the lytic action of the virus replication in erythroid precursors gives rise to a transient arrest of erythrocytic production. This can result in a slight drop in hemoglobin. Hemoglobin levels will substantially drop in those patients with chronic hemolytic anemia. This is the viremic stage, and mild flu-like symptoms with pyrexia and chills are not uncommon. These flu-like symptoms can last for 1 to 3 days. 1 week after the viremia peak, the second phase occurs, where the virus is rarely detectable. The second phase is where the erythematous maculopapular rash and arthropathy occur. The characteristic rash produces a lace-like appearance on the trunk and extremities and a slap cheek appearance on the face. Erythema infectiosum infections in pregnant women can induce fetal loss, 5 to 20%, especially if the infection occurs at less than 20 weeks. Which of the following best describes human papillomaviruses? A. Human papillomaviruses are small DNA viruses. B. Human papillomaviruses are large DNA viruses. C. Human papillomaviruses are large RNA viruses. D. Human papillomaviruses are small RNA viruses. The answer is A. Human papillomaviruses are small DNA viruses. These viruses replicate in the nuclei of differentiated keratinocytes and are the cause of tumors of the skin and mucosa. The genome of human papillomaviruses is circular and contains approximately 8,000 base pairs. For which of the following viruses is assay by viral enzymes particularly useful? A. Retroviridae. B. Hepatitis B virus. C. Mumps virus. D. Parainfluenza. E. Influenza. The answer is B. Hepatitis B virus. No suitable cell culture system is currently available for the hepatitis B virus. Fortunately, the hepatitis B virus produces a DNA-dependent polymerase that is virus-specific. Influenza A, influenza B, mumps virus, and parainfluenza virus may be cultured in primary monkey kidney cells. Influenza A, B, and C all may be cultured in eggs. Influenza A and B may be detected by hemadsorption, cytopathic effect, and hemagglutination. Influenza C may be detected by hemagglutination. Retroviridae may be cultured in T lymphocytes with methods of detection of transformation, reverse transcriptase, cytopathic effect, or immunofluorescence. Which statement is true concerning these three sexually transmitted viruses: human papillomavirus, herpes simplex virus, and hepatitis B virus? A. Of these viruses, only human papillomavirus has a genome containing RNA. B. These viruses all have a genome containing RNA. C. Of these viruses, only hepatitis B virus has a genome containing RNA. D. These viruses all have a genome containing double-stranded DNA. E. Of these viruses, only herpes simplex virus has a genome containing RNA. The answer is D. These viruses all have a genome containing double-stranded DNA. Human papillomavirus, herpes simplex virus, and hepatitis B virus are sexually transmitted viruses with double-stranded DNA genomes. While herpes simplex virus has a relatively large genome, the genome of both human papillomavirus and hepatitis B virus are both quite small. Herpes virus can be detected by the Nclex smear of the skin lesion. This test stains for the presence of which one of the following? A. Dead cells. B. Inclusion bodies. C. Multinucleated giant cells. D. Herpes DNA. E. Herpes cell envelope. The answer is C. Multinucleated giant cells. The Nclex smear stains for the presence of multinucleated giant cells that are formed as a result of fusion of cell membranes due to insertion of viral proteins into the membrane. Nclex smear does not detect the presence of inclusion bodies, dead cells, herpes DNA, or cell envelope. Which of the following is an etiological agent of infectious hepatitis and a member of the Picornaviridae family? A. Hepatitis C virus. B. Hepatitis B virus. C. Hepatitis D virus. D. Hepatitis A virus. E. Hepatitis C virus. The answer is D. Hepatitis A virus. Hepatitis C is an enveloped icosahedral RNA virus with gene order characteristic of the family Flaviviridae. The genome of hepatitis C is infectious and consists of a linear single-stranded 9.5 kilobits molecule of RNA. The virus replicates in the cytoplasm. Hepatitis C is transmitted by parenteral and sexual routes. It is the most common cause of post-transfusion hepatitis. Hepatitis C is associated with acute infection, chronic liver disease, and cirrhosis. Hepatitis C viral infection may serve as a predisposing factor in primary hepatocellular carcinoma. Hepatitis A virus and hepatitis C virus are not associated with parenteral transmission. Chronic carrier state. Chronic hepatitis. Cirrhosis. Hepatocellular carcinoma, hepatitis B virus, hepatitis C virus, and hepatitis D virus are associated with parenteral transmission. Chronic carrier state. Chronic hepatitis. Cirrhosis. Hepatocellular carcinoma.